Good afternoon, July 22nd, 2024. My name is David Knox. I have multiple system atrophy and my body has failed me. This video will be a bit of one where I try not to cry. When I do, I will fast forward to those when I edit it. It has been a while to get a video out, and the body struggles with MSA. It gets tired. It gets slurringly tired. Don't be confused here. I have a wonderful attitude, wonderful outlook in my own mind, but things are crashing down like I thought they were from some of my last videos. So I'm not going to talk about everything because this video would never end, but I definitely want to talk about a few things if I can keep on track here. My last visit to IU Health last week, what's upcoming, and the past few months, what's been going on. So I haven't posted many videos. It's ironic because the last video I posted properly was about your voice making. And I want to make something clear here. 4 months ago, I'm looking at my phone. 4 months ago, I went to my specialist at IU Health, and here's a quote from my pulmonologist and my ENT doctors. Oh, I'm sorry, they're all ENTs. They're that long word is it's a type of pulmonologist, but they're specialists. And she said, and I quote, "Surprisingly, his MSA has not affected the mobility of his vocal folds at this point. He does have severe vaginal spasms, which is being triggered mostly with swallowing his own saliva and small sips of liquids. I recommend we start OTB and working on his VCD. VCD is vocal cord dysfunction." So that was on April 17th, right after my oldest daughter's birthday of this year. Less than 4 months later, I have lost. I'm going to go back for the medical records here. I have lost my left vocal cord, which is why my voice sounds much softer. And as a matter of fact, just sitting here, I can now sense it. I can kind of hear it with the echoes of the wall in front of me, with the computer screens in the wall. I can actually hear that part of me, that part of that bass that's not there. It's like treble with no bass now. So I've now lost. Actually, I'm going to get the record for you. I'll try to cut out some of these things here. All right. So the person I saw was a otolaryngology provider. So her record that I went to see, the first visit in April, I was complaining about choking, swallowing, the spasms, aspiration, and also catching my breath. My lung issues, which had just really started at that point. And here she talks about, I scroll down to the bottom, she talks about my left vocal cord appears to be immobilized while the contralateral, the opposite side of it, has intact mobility. So my right side's still working, right side's here, left side's over here for the video. With an increased vocal fold, with macusal waveform amplitude on the left more than the right, consistent with decreased tone. So I sound the way I do. There's a large anterior glottic gap on phonation with no defined mass lesions. And that's important because that gap I had, I remember the last time I had it scoped, even with my other ENTs up north here, that gap on that little thing, I told you, that little thing that helps you close the airway so you can swallow or speak or whatever and breathe. That was the gap right beside it was very small. As a matter of fact, the last medical record said it. The last medical record 4 months ago said it was a minor gap, right? Minor opening, and now the doctor says it's large. There's a big difference between minor and large when it comes to medical findings, right? So terminology. And the fact that there's no mass lesions means there's no tumor, there's nothing there that's causing it. So, it's more than likely is that, I'm not going to say all for sure, but we know it's the MSA, the neurological component of it, that's affecting the throat, that area. She says that there's also moderate supralogic hyperfunction, which is muscle tension dysphonia types 2 and 3 on phonation. So my vibrations of my muscles are too active when I'm actually trying to, like they have you do these weird sounds. That's what they're looking for. She says the larynx demonstrates mild diffuse laryngeal inflammation with a reflex finding score of reflex score RFS of 16. I've had that before, and it quickly went away. So the question we have is, why am I still getting this reflex score? Greater than 14 or 15, I believe, is abnormal, is significant, right? Abnormal. And I don't know why. So they took care of it before my other ENTs, and they took care of it with medication. But yet I still have this reflux. And remember, they took a biopsy last time, and I have these cells down there that aren't supposed to be there. Now, a lot of us get cells, other squamous cells that come up into the throat from the stomach because of acid reflux and things like that. It is quite normal. But when that reflux is not there, those cells should not be there. So it's interesting how those things are still active. Those cells come up into your throat because of inflammation. So I have not had inflammation in 2 or 3 months, and why is it still there? Great question for another day, I guess, right? I can't read the notes before I leave, so it's one of those things. The last thing she speaks about is on her findings from the scoping was pooling of saliva. I complained to her about my excessive salivating saliva, not only sleeping, but anytime when I'm working, taking a shower, anything I'm doing that's not like I'm not going to pay attention to my mouth. I drool like a pit bull, and that's probably a Labrador Retriever or something. I drool excessively. I mean, I go everywhere with a towel now, so I can wipe my so I can wipe my spit, my saliva. And the same thing at nighttime. I sleep with a blanket now, or a towel, a big towel, because I woke up this morning to a pool of saliva. Does it hurt anything? No, but it's kind of weird sleeping in a wet spot, Now, what's interesting was she found pooling of saliva, and pooling of saliva has one of two meanings. Well, there's no reason why you should have pooling of saliva if you don't have a physical problem with your mouth. And the pooling of saliva that I have is not a physical defect at this point. Do I have excess saliva? Yes. The brain is not telling the mouth what to do correctly, right? So, upon talking about it, there is an outside chance that would be throat cancer, the beginning of throat cancer. I'm not a smoker. Never have. I won't lie to you. I can count this amount of times I've ever smoked anything. Anything. One handful. I don't enjoy smoking. I don't like cigarettes. I like the smell of maybe cigars, but I don't smoke them. There's a big difference. So, and my friends know too. Everyone wants to offer you this, offer you that. I hate smoking. I'd rather have a shot of vodka to get high on weed or tobacco or anything like that. That's just me. I never got into it. My dad smoked for a long time, and maybe that's what got me out of it. I want to be active, and I don't want to be like my father did and smoked all the time until I was later in my life as a child. So that's one thing we got to keep an eye on, is that pulling of saliva in the throat. So she came back with the three diagnoses again. So vocal cord dysfunction is, again, I've had that one before. Siluria, it's K1117 is the code, and that code is I guess excessive saliva. And then R1310 is dysphagia, right? The facial stuff. So, and swallowing. I'll read to you what she says here. All right. Well, not all. I guess we kind of talked about it, but I talked to her about the also belching, burping. It's not one motion anymore. The same issues we have with running, walking, urinating, defecating. I think that's the word. And belching, like things like that, it's all the same thing. It's just not one muscle that causes these things. It's several sets of muscles that act them in tandem, and they have their order, right, in synchrony. They have to synchronize their movements to expel gas, pee, poop, whatever. And I noticed a month ago, I was trying to belch. I had a big burp because I always have excessive air in my intestines, which all the X-rays they always say that, which is abnormal. When I went to burp, it wasn't just it was one time. It was it was the weirdest burp I had in my life. And again, the reason is because the muscles are not working together. Maybe not all of them, but a good part of them are not working together to expel the air. So we agreed. I talked to my good friend Daisy, who I've ignored the last couple of days because I've been really down and I haven't wanted to speak to anybody. So this is my first video of speaking to anybody, including my mom and my wife and stuff, about what the visits. So you guys are my crutch today. And we agreed because I spoke to Daisy, and Daisy says she also gets Botox for this saliva, and I think for her throat muscles too. My doctors told me that my throat muscles, and I recorded it on my Otter, but it must have glitched out. That's the only visit I don't have a recording to remember what they said. She told me my throat muscles are the weakest they can get before they fail. The weakest they can be before they fail completely. So we're moving up timetables for getting Botox injections. Botox will not only help stop salivating so much, but it also helps hopefully strengthen out my throat. And they think that because the dilation I had, the scoping with dilation, that widened out my lower throat, esophagus, my throat down here, has helped with some of my spasms, which is really nice. I told them about 60% of my spasms have gone away, choking on pills and stuff. It still happens quite often, too much, but at least I got a bit of a reprieve from it. And she says since that happened, we're going to try to Botox, and as long as my body can take it well, then hopefully I should see some better improvements with my throat, at least maintaining, if not some improvements, some minor improvements. But that's important. I said that for a while. The rest of my symptoms have kind of maintained. Are they getting worse? Sure, but I've adapted to them enough to where I can not really notice them too much. Unless something drastically happens, pee your pants, poop your pants, whatever, something drastic like that. But I've been mentioning the last few months, including on the podcast. You can listen to us on the MSA Crusader podcast. This right here, is I'm going to die right here. I'm going to die of this in my throat and my lungs. It's moving so aggressively that I knew at the moment it started happening a couple months ago. I said, this puppy is in 4 months, less than 4 months, May, June, July, in 3 months, I've lost half my voice and almost all of my muscle strength in my throat. I told you this thing was coming quick. And there's some things we can do, right, for other things, right? I mean, exercise and therapy, but for this, you just can't say, I'm going to swallow 20 times extra today. It doesn't work like that. It's hard. The body doesn't want you to move, so you stop moving. It is quite hard to get this stuff going. And I've had plenty of therapy for the voice and for everything down here too. And it just wasn't budging it at all, which is kind of depressing, so to speak. So I went to the critical. I don't think it's called critical care. It's called. So last week I went to a few appointments, and I also went to. Let me find it for you. Don't want to mislead anybody here. It's on my Facebook post. Went to Indiana University's Complex Care Clinic. Complex Care Clinic, CCC. It's like when you go to Mayo Clinic or the, well, I lose my mind about Cleveland Clinic, where you go at one time and they see you and try to get your evaluations done all at the same time. It's kind of like that. It's not as formal as it's not as a brand name as Mayo Clinic or Cleveland Clinic, but it's really nice. We have a lot of people come to see us, see me, my wife and I. And man, were they very helpful. Man, were they helpful. I just want to say that. It's unbelievable. So every month, on different days of the week, they have where certain types of people come in and they get help. Like ALS is one day, people like me, neurological muscular stuff is one day, and I think like I don't have a full picture, but Parkinson's, whatever, stuff like that. They divide it up and they come in and help you. And the one big thing that stuck out for me, I'm down 15 pounds from a couple of weeks ago from my weight, and they were talking about might be time we're getting darn near close to getting a feeding tube, and that kind of caught my attention. Nobody wants a feeding tube, or nobody wants a trach or anything like that. So that was kind of hard to digest no pun intended, to digest for a second. But being down 15 pounds in about 2 weeks, eating is hard. Swallowing is harder. I can move my legs. They have issues. Walking down the damn stairs is even harder, having faith it's going to work. So when I say chewing is one thing and swallowing is another, let me tell you, it's terrifying. So much so that I need caffeine, guys. At least the liquids are still pretty good. I can't drink laying down though. Drinking laying down will kill me. Will hurt me. I can chew and eat, but swallowing is so taxing on the body. It's just, I'm tired of choking. Here goes a crying for you, right? And I don't know who needs to hear that. I don't know how you communicate what I just said to people who don't have that issue. I can struggle chewing. I can struggle. I can swallow 20 times in a row because I can't get it all down in one gulp. Whatever. Swallowing it down so you stop choking, either on air going into the wrong way, saliva going the wrong way, or your food or liquid going the wrong way. Aspirating stuff, right? If not the spasms of choking, it's taxing on the body. It's taxing. It takes a toll. As much as I mow the grass and it takes me out for the day, as much as I went to the appointment, I parked in the back parking lot, and walking a few hundred feet wiped me out for the day. I lost my voice on my first appointment from walking a few hundred feet away. Yes, I know, scooter, wheelchair, shuttles. We're not talking about that. Stop talking about that shit. Stop it. The point is, those physical movements are taxing, and it takes a day to recover, if not more. So when I choose to eat, I have to really want to eat, because I don't want to get high or drunk for no reason. I don't want to choke on my food or drink for no reason. It's horrible. We went to a brunch last weekend in Chicago. Two of our good friends' birthdays were down there. They already had their birthdays. We were just all getting together because very good group of people, friends that my wife and I have, and they had a brunch buffet, very nice downtown. For the price, I was very surprised. And I couldn't eat half of it because of my issues with chewing and swallowing. Even the stuff I did try to eat, I'm there choking on the table and crying, and my ears are not crying like that, but crying because I'm choking on stuff or have to visit. And it's horrible. So when you go out to eat, you don't even want to eat. You don't think I like Wendy's chicken nuggets? Of course I do, with the barbecue sauce. I love them. But I want to choke. The same thing with Subway. My wife says, "Do you want some grapes?" I do, but the skin of the grapes gets stuck. It's weird. So, dropping some pounds because I don't, not because I can't eat, because I don't want to eat. It's hard. It's hard. Yes, I know I have to eat. Yes, I know. David, there's shakes, there's this, there's that liquefied. Yeah, it's the same thing. I choke more on my saliva and spit and air than I do on food. Probably because I don't eat as much as I swallow and breathe. But the point is, it's a dual tandem thing here. It's just not one thing. So when they talk about giving a feeding tube for you, I'm still 6'1", 188. I've come way down. I've come way down quickly. Okay. And seeing my neurologist, she was the last visit. I didn't see my MDS, my movement disorder specialist, Cynthia Bodkin. I saw a nurse practitioner, keyword, who's helping with the critical care committee, whatever I told you that thing was. Very nice lady. Nothing against her. She was the first person that really seemed like they wanted to have their own opinion in the matter about diagnosis and all this other stuff, and that's not her job's not to diagnose me. Her job is to take care of me. Other doctors have diagnosed me. It's it's the first time that I got a little bit of a little negativity, not from her in a bad way, but just when people put their own 2 cents in there, sometimes it throws you the wrong way, and maybe it's just me that day, maybe not. So she comes back with the other 4 diagnoses herself, and her 4 were the Parkinsonism, G20.3, G20.C, which is MSA is a Parkinsonism. The telltale signs are those Parkinsonisms you add together and you get MSA. So no shock about that. She put the MSA on multiple system atrophy, G90.3. No surprise about that. She also put on orthostatic hypotension. Shortness of breath. Orthostatic hypotension is I believe that's an I95.1 code. Shortness of breath, R06.02, and neuropathic pain. Not neurogenic, but neuropathic pain, which she's saying, hey, it's coming up here, M79.2. So the orthostatic hypotension we're working on now because since my last video, the blacking out and whiting out, my eyes blacking out, going black or going black, or going black or going white, and losing consciousness is creeping up too much. Like anytime I get into the heat, any sunlight, and right now I paused for a second because I was starting to white out and look at the screen. I'm trying to focus on my face on the screen while I'm not passing out. But I imagine that's why a lot of people with MSA or even Parkinson's, so to speak, don't like to move their eyes and heads, because the moment I move my eyes to look way down or way up, or my head, or my body, things get really bad and I pass out. I want to pass out. So they took note, and I told her, I said, I try to take blood pressures as quick as I can, and I just can't catch abnormal. Do I have abnormal blood pressure? Here and there. If anything, it's high. And she says it never goes low, and we talked about the numbers. I said, no, not what she's talking about. She said, that lower number never hits 40, 50, 60. No. Today I had my low blood pressure number was like over 65. I was like, wow, that's the lowest I've ever had that I can remember, over a 64. It was 120 over 64. That might be normal, but I'm not sure, but 64 is the lowest I've ever remembered in my life since I've had this issue of MSA. So she says the issue probably is it's happening so quickly, that the change so quickly, that you can't capture it with your blood pressure watches or medical cuffs or whatever. But she says that's the hallmark. What I described to her was in fact a hallmark of neurogenic orthostatic hypotension. So, um, even when I was at the Mayo Clinic and they had those blood pressure tests, the tilt table, they still bring you up and down, and they count to 1 minute and they test you. So, my stuff doesn't typically last longer than a minute unless it's very severe. So, looking back on that, it makes perfect sense because they wouldn't have caught it either. By the time I'm able to get my crap together and push on, it usually is less than a minute. Unless like heat or something has an outside factor is not helping, right? So she's always going to help me with that too, and I'm very happy I was able to talk. So these appointments in the CCC, right? In the trying to find it again for you. In the complex care clinic, or Mayo, or these other places, they have those times for you to come in because they give you a lot of time. Our good friend Paul, who was on our last podcast, he in University of Virginia had his done. He was there for 8 hours. Ours took 3 or 4 hours. It wasn't that bad, but there's a couple of doctors we didn't see because they weren't there at the time. But they give you as much time as you need to speak, to say your issues, to talk about the issues. I was very amazed. Nobody was rushing out of there, right? It was speak your mind, keep going. So I was also talking to him about my electrical shocking, random on my body. I've talked about forever on my YouTube channel. It hurts. Sometimes it feels shocking, right? Like a taser or whatever. And there's sometimes, not all the time, but maybe 20% of the time, it feels like a lighter is on your skin. Direct fire. My heart rate's killing me. My heart rate just... that's POTS for you. Your heart rate just goes crazy for no reason. But that was one issue which I'm okay with for right now. But the last week or so, my jerks, I forget the name of it, there's a word for it when it comes to your whole body jerking at one time, and it's mono something, I can't remember, but some gentleman on my Reddit channel said the word, and that was actually it. So since about a week ago, my whole body is, the whole body jerking, up lower body or whole body, like it does what it wants to do. And I told her, I said, it usually doesn't happen too often, but now it's like every minute or two that it happens. I can't control it now. It's the nighttime. It's during the day. Is there anything to knock that down? So she's giving me we're gonna get some medicine. I think she said so she's gonna give me fludrocortisone to help with the BP. And she's going to give me also some duloxetine. I think duloxetine is for the neuropathic issues, the shocking and the jerking that I have. That stuff has come by. I may have episodes of it happening, but it's like every minute or two, and it happens all the time now while watching movies, TV shows, anything, like reacting to my wife or kids beside me, whatever. The body is like just trying to fend itself off. So that part of it is definitely taking a toll. She also ordered a home sleep study. Kind of weird, sleep studies are to detect your movements. And the only thing I just kind of disagree with her was she wanted a home sleep study, and that's cool. I can show you every night of my videos of me acting out dreams. It's like, you don't need a sleep study for that. I guess in the real world, though, to rule out me manipulating the system and lying about it, right? I completely understand. So maybe that's what they want to have, is something on paper that shows. Because my last one was inconclusive. It showed the muscle tone and my muscles trying to act things out, but not necessarily the limb movements. So that's why, and that was very early on in my MSA diagnosis. So that's fine. I'll get another one, and we'll go from there. Um, but the visits went very well, and as I struggle to speak and keep my voice, um, they also gave me two pulmonologists for my lungs for breathing. Yeah, I have this issue here, but my chest. Nobody knows what it is to break your back until you've broken your back, like me, right? I mean, no one knows what it is to have cancer. She had cancer. Nobody knows what it is to pull a tendon or tear a ligament if you haven't done it before, right? So, with that said, the exhaustion, fatigue, and I think muscle pain is a better way to describe it of my lungs, not the outside of my skin like my spasm, my electrical pain is, but under your ribs are your lungs. And it's very different pain when it's inside of you, deeper than the superficial part of your outside of your skin, the fingertips and things like that. It's a much different pain. And like right now, my lungs hurt from breathing so much, from being taxed. I did mow the grass in the front yard this morning, for better or for worse. And I did go to my psychiatrist appointment. He's a doctor, I'm not sure which one, forgive me. And I tried to I was fixing the bottom of the dishwasher. It has a small leak. Whenever something isn't done right, there's a small leak. So those three things have wiped me out already for a day, and it's 12:49 our time, Central Time, PM. But the using my body too much, the breathing and stuff, the lungs hurt, and it's a pain that it's not like anything else that you probably know. Have you ever had pneumonia? I have. It feels like that. So take out the pain of coughing, right? I've broken ribs from coughing too much with pneumonia. I get pneumonia a lot. Thankfully, I have not had. Thankfully, I've not had pneumonia in a few years. That would be the death of me. But pneumonia wears your lungs out, kind of like bronchitis and stuff like that. And that's what it feels like without the sick part. Lungs are, my heart rate again. Well, lungs are fatigued and they hurt. So, it's, I told the doctors the last couple I went to go see, the issue now, my life is here and here, and these things are going quickly. I can tell. I'm not worried about my legs anymore. I'm not worried about this or that, or my eyes, my double vision, my bladder, or my gastrointestinal issues. I'm worried about my core, because that's how we with MSA die, right? Most of us, rather. So it gave me up to some pulmonologists to take care. I see one right now in an ENT fashion, but I see a pulmonologist. I got to go back anyway. I'd rather see my IU pulmonologist because they're all on the same page. I promise you, there's nothing better than going to your doctor specialist visits, and they're all on the same page, and they all have tests waiting for you, whether or not you want tests or not. It's nice to have doctors. You show up there and they have the scope waiting for you for your throat. You're like, good. They're going to actually have some answers for you. It's nice to have that. So, my ENTs up here in the north, pulmonologists up here in the north, are really nice. Surprisingly, I don't mean that in a bad way, but I'm going to go to my IU ones because they're all on the same page, and they are getting me on the speech therapy and OT, occupational therapy, physical therapy, all these other things. To keep me going is a little bit hard, but trying to keep the body in motion. Now, with this part of it said, the my body's muscles and like legs and stuff have almost stopped working, and I say that from a person who is headstrong, who's prideful, who's proud, who as a man, who's a father, who's a husband and a son, right? Active, healthy, strong. What's my heart rate again? I don't have anxiety like that, but my heart rate is uncontrollable this morning. I'll tell you, when you see your heart jump, it's like having palpitations, like anxiety or nervousness, but it's all day long and it's random, right? I'm a strong person. I'm strong-willed. I'm too headstrong sometimes. You see, by the way, you see my posture. I'm not moving. My posture is too far forward now. The reports, like they're talking about, he stoops forward. My gait, my movements the score that I'm gonna get for another video. The scoring for my gait and my movement is +2, +3 from the last one, +2, +3 from the last visit on the scoring system. And when I'm walking, I don't move my arms at all. So we went from some to minimal to none now. Just the body is too tense. The muscles are too rigid. My muscles hurt from the muscle wasting away. Like it's similar to you have ALS. Now ALS, the hallmark of ALS is your brain stops sending signals to your muscles to move, and your muscles waste away because you don't move them. And in the fashion, that's what's happening right now with me. Is the muscles are wasting away. You can feel them because I'm not using them as much as I used to. Right? It's like losing muscle mass and getting fat on your body. You can tell. Except in this case, it actually hurts when you lose your muscle. It's all wasting away. Right? So my body, when it comes to walking, it's hard. Trying to sit down and wipe your ass is hard. I mean, trying to move over and wipe is tough. Trying to scratch your back is somehow, some way. Now, I know there's things to do it for you. I'm not talking about that. But the range of motion is tough. It's restricted. The neck is the same way, right? And she sat there and they're looking at me again, move your eyes, do this, do that. My eyelids don't go up very much at all. She says my eyelids don't move up. Very minimal. Eyes go down, but going up, my eyes struggle, and the eyelids don't go up. Right? You gotta keep an eye on it because remember, PSP, the hallmark is the eyes not moving up or down, either or both. But I believe she was speaking about my eyelids at a point. Muscles don't. So muscles don't move. You start losing the function of them. And that's one of the other things that really has me frustrated right now is the body is not in motion. Even when I try motion, like I tried to do something this morning, did I overdo it? I don't think so. Say what you want about me. I don't think so. I think you have to be. My physician, physical therapist, and stuff that were at that appointment, they were kind of being mean to me in a very nice, respectful way, telling me I can't do this shit. Knock it off. Right? But I'm glad they didn't tell me. I'm glad they didn't kick back with me, because they're talking about installing a power chair going up and down my stairs. And I said, no, I don't want that shit in my mind. I don't want that in my mind. So like, stop. I don't want that. I don't want that interfering with my own mind, my own thought process. I don't want to see it. I don't rely on it. I don't want to look at it. I don't want to hear about it. So when I say these things, I'm going to say something very mean that you might find offensive. When I say I'm having issues, I'm stronger than you. I'm stronger than you. Don't take offense to that. That's the attitude you have to have, or you're going to die young. You're going to die quickly. You just can't be strong for yourself. You have to be strong for others. So when they talk about installing this and doing that, doing this, feeding tubes and medical chairs for the stairs and things like that, I don't want to hear that. I don't want to hear it. It just invites the devil, I'm going to say, into your life, into your mind. Oh, maybe I should get the chair. Yeah, I know I'm going to need it at some point. I know that. Ladies and gentlemen, I know I'm going to need these things later, or I need them right now. I know that. Being hard-headed is what keeps somebody from doing bad things to themselves when they know they're not going to live. Being hard-headed is what keeps us strong for my kids. Keeps us strong for our spouses. Our mother. And being strong, hard-headed, keeps us strong for those in the public, on YouTube and Reddit, right? And Spotify. Keeps you going, because if David Knox can do it, so can you. It's easy to give up and just medicate yourself to death. It's easy to give up and take that wheelchair. It's easy to give up. And I know there's times when you have to. I know there will be a time when you have to take these things and rely on them. But that will be the last thing that I do. The last thing that I do. Without the attitude and the willpower to keep going by yourself, independent as much as possible, you don't have anything if you lose that. My body is a wreck right now, and I haven't told you half the things the doctors told me. My body is a wreck. So, when it came to my physical movements and legs and stuff like that, I compensated. I changed plans. I do this, I do that, I did that. Well, when it gets tougher, change your plan of attack. And for these other things, what can you do? You keep trying other ideas, other things. I don't care if it's medical, natural, herbal, physical, what? Keep trying, keep going. That stubbornness of a man is usually what keeps him alive longer than the average person. It is. So when you see me talking and saying things like I'm stronger than you mentally and physically, it's because I am. It's because I have to be. Because without that attitude, you succumb to this disease very quickly, and it takes you over. With the help of God and my family, I'm still going. And even when I pass, it will not be God's fault, and it will not be my family's fault. It will be life. So you might hear me saying more references about life in general, right, in passing. But that's where we're at right now. Remember, there's quite a few of us that maintain a lot of our physicality until the day we die. Still almost completely able to function, walking, bicycling, whatever, until the day we die. Almost. There's like a month or two lag, and then you go to nursing home and die, or stuff like that, or a hospital. Right? I just had my first major fall. When I say major, it hurt in the garage. It hurt. I'm surprised I don't have stitches. I don't think I would have went to the hospital anyway for stitches, but I'm surprised I don't have stitches today. It was 2 weeks ago. My fall that you have is average. Is nothing to me. I don't care about falling. When I say major fall, I mean down the stairs, into a 2x4, bleeding, whatever. I'm talking about major things. I fall many times a day, but it doesn't hurt because I react to them. I'm proactive. I understand this is how I fall, and I prepare for these things. But when you can't brace yourself, you can't even flinch to react to something, yeah, it's going to hurt a lot more. So, otherwise, I have a group of good doctors. I'm going back in a few months for the clinic I just had. It's 3 months. They said for 3 months or 6 months. I think in January. I can't remember. It might have been earlier than that. I have a lot of outstanding appointments ahead of me, and again, I've been replying to a couple of posts. I haven't been active because typing is almost not happening anymore. So how I'm going to edit this video, I don't know. We'll see how quick I can do it. I don't have to type too much. I just have to really move a mouse, and that's even hard. But there's a lot of outstanding appointments in front of me, and we're moving in the right direction, right? MSA is coming, and it's coming strong. The last few weeks, it's attacked the whole body, my muscles, my movement, and my lungs upwards has gone to shit. Everything else is still maintaining. It's still hurtful. It still sucks. It still doesn't work right. But what are you going to do, right? Adapt, try new things, and keep going. this last few weeks have made me think twice about life and doing things and what I can and can't do. A little more emotional too, which is why I also haven't posted a lot. But that's not my that's my heart again. That's not what I want to do. I told you from the beginning, these videos were to show those people that have MSA after me what it's like and what happens, to describe them. And it's quick. Nobody's the same. I mean, the last podcast, Paul Gibson, I think, we're very almost identical in how our symptoms are and started and things like that. It's hard to see things like that from MSA patients. We're so different. And my point is, you might think things are going great 1 month, you're maintaining, and then bam, here comes 5 other things out of right field, and it has you questioning your own life. All right, if you want to keep going or not, is it worth the pain? Is it worth the effort? And the answer to that question, yes, it is worth the effort. It is worth the pain. It sucks. It sucks not to have an issue to roll out of bed, right? To get on your feet, to not kill yourself. It sucks. And it's compounding with me, so, I'm not saying I'm dying tomorrow. That's not my point, but I have the videos are to show you guys me, my life, and what MSA is. And a little bit of education too. So I hope they do well. I'm going to keep getting videos. I know I say that and I don't do. I got a lot of unedited videos I haven't sent out. It takes effort to do this. I mean, right now my arms, my whole upper body is just completely too shaky to do anything at the moment. So I'm going to try my best to get this out. Even unfortunately, if I don't edit it, it's just live or unedited, or raw, so to speak. But please get to the right people when it comes to doctors for your care. Please, 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 please get to a multidisciplinary care facility. Your doctors should all be on the same page. I'm so happy. I don't have stress from my doctors that they don't know what they're doing, or they don't understand, or I can't see them, because they're none of those things. They're smart. They're on the same page. They all read each other's notes. It's great. It's great. Get yourself to an academic university, multidisciplinary team. Mayo and Cleveland Clinic might be the exception, right? Vanderbilt and that's academic. Florida State University, that's academic. There are some places that may not be academic, that may be the exception to the rule. But if you have a disease like this, including MSA, you need to get to a multidisciplinary care unit. That's the only way you're going to get help. I just got done in 3 days what would take most people years to get done. You can't trade that. You don't have the time if you have MSA. You don't have the strength. And you don't have the resources around you all the time. So please, I hope you enjoy the video. If you do, give me a like. Don't have to, but definitely share it if you think anybody would benefit from this video, or my channel, or even the MSA Crusaders podcast we have, Daisy and I. Just share it to get the word about this out. What we're trying to do for MSA, right? We're all in this together, and as Daisy would say, we're all MSA Crusaders. And I will see you in the next video. I promise you that. Have a good one.